Hello everyone, myself Dr.LOVELEENA. I have done my MBBS and MD in microbiology. I have more than 20 years of teaching microbiology experience. Currently I am working as head of the department at ASMC Pratapur. Well, that's my brief introduction. Now the introduction to the subject that I'll be taking up. I'll be taking up microbiology. Everyone knows microbiology. Karuna introduced it to the world. Microbiology is a study of microorganisms. Organisms which are too small to be seen with the naked eye. Though we do have parasites which are several meters long, they can be seen with the naked eye, but traditionally we defined microbiology as the study of microorganisms which are too small to be seen with the naked eye, including your bacteria, parasites, fungi, viruses, and traps. So microbiology has several branches. They include, to name a few, food microbiology, that is dealing with the production of your cheese, wine. You have industrial microbiology that deals with your alcohol production. You have marine microbiology, which deals with the study of the marine sea. Then we are interested in medical microbiology, and that too in the medical microbiology we have clinicians. We will be taking up clinical microbiology. So what is clinical microbiology? Clinical microbiology is concerned with the prevention, diagnosis, and treatment of infectious diseases. What all will be covering up? We'll be covering up general microbiology. Now in microbiology, general would include the study of bacteria, which we call it as bacteriology. It will also include the study of viruses, which we call it as virology. This also includes the study of parasites, which is your parasitology. This also includes your study of fungi. It's not fungology, this is your mycology. So this all would be covered up in your general microbiology. We'll be covering up the response of these microorganisms of our body to these microorganisms, that is your immunology. Really covering up infectious diseases, that's your systemic microbiology. And last not the least, and very important part of clinical microbiology is your hospital infection control. Everyone will be working in the hospitals. So very important component of the hospital nowadays is your hospital infection control. So that was my brief introduction and the introduction of the subject. Now let's come to the history part. In brief history. Now microorganisms, we said they are organisms which are too small to be seen with the naked eye. Then how do we visualize them? We visualize them with the help of a microscope. So who was the first person to use microscope or to develop microscope? So the name of the person, Antony van Leeuwenhoek. As he was the first person to use microscopes, so he is known as the father of microbiology. He is known as the father of microscopy. So he was the first scientist to observe bacteria and other microorganisms using single lens microscope. In his diary and story, he observed the parasite Giardia, though it was later described in detail by Lamlier. So this parasite will be dealing with parasitology. He called these small organisms as little animalcules. But as a science, this branch was developed by Louis Pasteur. He is known as the father of microbiology. He is a chemistry professor. He proposed the principles of fermentation. He introduced the sterilization techniques. We'll be reading in detail when we read sterilization process. So he introduced autoclave. He gave us hot air oven. He gave us steam sterilizer. So these were the things he gave us. Besides this, he gave us a very important technique. He gave us pasteurization of milk, by which now world over we have safe milk to drink. Vaccines. He developed the vaccines of anthrax, found on chicken cholera and rabies. He postulated the germ theory of disease. At that time, the theory which was known is, which was accepted by the majority people, is called the theory of spontaneous generation. That the organism, they generate spontaneously. He said no. This organism do not generate spontaneously. And the basis of the disease is the germs. He gave the liquid media concept for the growth of microorganisms. And he's the founder of Pasteur Institute of Paris. Now, this is a very important question for the undergraduate students for your pre-university, university, and your terminal exams. So, easy way to remember, instead of a mnemonic, we can go in his name only, that he gave us pasteurization of milk, and the Pasteur Institute after him in Paris, he gave the sterilization techniques. They are autoclave, hot air oven, and your steam sterilizer. T for germ theory, he gave us the germ theory of the disease. E, etched. He removed the theory of spontaneous generation. U, he gave us the understanding of the principles of fermentation. From R, you have these vaccines for your rabies, cholera, and chicken cholera, and your anthrax. And his name starts with L, so that is your liquid media concept for growth of microorganisms. So when Pasteur gave that the germs cause disease, many scientists began to say this. They have found this organism, they found that organism causing this disease. But it was Robert Koch. He said, he gave Koch's postulates. What are these Koch's postulates? These are the criteria to say that which have to be fulfilled before you can say this organism is the causative agent of this disease. So Koch gave us Koch's postulates. These are the criteria for proving that a microorganism isolated from a diseased person or animal is causally related to the disease. For example, he gave us 4 criteria. Let's see what are those. A person comes with cough, fever, weight loss. The first criteria is that organism has to be constantly associated with it. To say that this bacteria causes these symptoms, so whenever you find these symptoms, this bacteria should always be associated with it. Now, from these lesions, you should be able to isolate this organism in pure form in the laboratory. That is your second postulate. Third, this pure culture, when you inoculate into a suitable animal model, it should produce the same disease, same lesion. So that is your third criteria. Now, from this animal model, the lesions produced, you should be able to re-isolate this organism in pure form. So when the bacteria or the microorganism fulfill these 4 criteria, then you can say this microorganism is causally related to the disease. Later, a 5th criteria was added, which says that the specific antibodies to the organism should be present in the genome. Let's see it once more. The microorganism should be constantly associated with the lesions. Okay. The first is this organism should be constantly association should be there. Well, from the lesions, you should be able to isolate this organism in pure culture. Okay. So you should be able to isolate in pure culture. When you inoculate this pure culture into a suitable animal model, you should produce similar lesions. And it should be possible to re-isolate the bacteria in pure culture from lesions produced in the experimental animal. So that is your fourth criteria. The additional criteria, or the fifth criteria, it should be possible to demonstrate specific antibodies to the microbe. Now, this was the criteria he gave, but later it was found that certain organisms do not fulfill this criteria. For example, now this is a very important PG question. What are the exceptions to Koch's postulates? The causative agent of leprosy, which is your Mycobacterium leprae. Till date, we have not been able to grow this in the artificial medium. That is your second criteria. We have not been able to grow it in the pure culture in the artificial media in the laboratory. The pathogenic species of Treponema palmatum, the causative agent of syphilis. Till date, we have not been able to grow this in the artificial, we have not been able to get the pure culture in the laboratory. The last one, Neisseria gonorrhoeae. We have been able to isolate this in the pure culture in the laboratory, but till date, we do not have a suitable animal model for Neisseria gonorrhoeae. So these are the three exceptions to Koch's postulates. So by satisfying Koch's postulates, Koch said in 1882 on 24th March that he has discovered the tubercle bacillus, the causative agent for tuberculosis, and till date we celebrate 24th March as the World Tuberculosis Day. He also discovered Vibrio cholerae. He studied anthrax in detail. He developed the bacteriological techniques. He developed staining techniques using aniline dyes. He gave solid media for obtaining pure culture. Liquid media was given by Louis Pasteur. The solid media was given by Robert Koch. So for his contributions, he is known as the father of bacteriology. So who is the father of microbiology? Pasteur. And who is the father of bacteriology? It is Robert Koch. He also studied a very interesting phenomenon that guinea pigs, when they were already infected with the tubercle bacillus, when they were again injected with the tubercle protein or tubercle bacillus, they developed a hypersensitivity reaction. Hypersensitivity is a immunological phenomena we'll be reading in detail. For today, just know that Koch's phenomena is guinea pigs previously infected with tubercle bacillus developed a hypersensitivity reaction when injected with the tubercle bacilli or its protein. So, everyone knows about this test, Worm-Tooth test. What is this test? You put up tubercle protein in the forearm of a person, patient whom you are suspecting to be infected with TB. So, after 48 to 72 hours, if you find a hypersensitivity reaction, you say the person is suffering from tuberculosis. So, this is the basics of Worm-Tooth test. So, coming to other important contributions of the scientist, Edward Jenner, he saw that the cow mates had cowpox, they did not get smallpox. So, he applied this in practice and he immunized children against smallpox using cowpox virus. And he was the person first to use vaccine as the term. Joseph Lister used carbonic acid for antiseptic surgery. So he's known as the father of antiseptic surgery. The very important scientist is Paul Ehrlich. Now, he used magical bullets. Magical bullets, these were the arsenical compounds which he used to kill the spirochetes of syphilis. We read now the causative agent of syphilis, Treponema palmatum, which does not satisfy the Koch's postulate. Now, he used arsenical compounds against them to treat syphilis. So, by doing this, though there were side effects, but he paved the way for a new branch of medicine, which we call chemotherapy, and he is known as the father of chemotherapy. He was the first to report the acid-fast nature of tubercle bacillus. We'll be reading in detail the Zn staining or the acid-fast staining in the next video. But the first time it was demonstrated by Paul Ehrlich. He studied the toxin and antitoxin quantitation, which we call it as the Ehrlich phenomena. We have a bacteria named after him. We call it a bacteria Ehrlichia. He was awarded a Nobel Prize in Immunology, and he's the founder and first director of Paul Ehrlich Institute in Jammu. The Pasteur Institute is in Paris, named after Louis Pasteur, and the Paul Ehrlich Institute is in Germany, named after Paul Ehrlich, who is the founder of chemotherapy. So, but very important contribution, the electron microscope. It was discovered by Ernest Ruska to visualize the viruses. Gram staining. The gram is not the weight here, okay? It's the name of a scientist, Hans Christian Gram, who first described it. That's your gram staining. It's a very important diagnostic tool in microbiology. We'll be reading in detail. It was given by Hans Christian Gram, the gram stain. Alexander Fleming, you have read it in our previous classes. He discovered penicillin. Barbara McClintock, she discovered mobile genetic elements in bacteria, which we call them as transposomes. Walter Gilbert, Frederick Sanger, they gave the DNA sequencing. So the DNA sequencing, we have the technique named after it, the Sanger's technique. And for every nowadays, the test for diagnosis of an infectious disease, you say PCR. Corona ka test PCR, TB ka test PCR, and HIV ka test PCR. Who gave this PCR? Carrie B. Nellis, and she was awarded the Nobel Prize for it. So after this brief history, let's have a look at one or two MCQs. What is a good MCQ? One of the criteria is a cover test. Cover test? You just read the question. Without looking at the options, you should know the answer. So that is the cover test. Let's try this with the first one. What's the first MCQ? Who is the father of microbiology? We read it. Everyone knows the answer. Who is the father of microbiology? Okay. So let's have a look at the options now. The first option, Lewis Hawk. Is he the father of microbiology? What did he give? He was the first person to use single lens microscope. So he is the father of microscopy. Louis Pasteur. Yes. He is the father of microbiology. His contributions are many. He gave liquid media, he gave pasteurization of milk, he gave the Pasteur Institute in Paris, he gave the sterilization techniques, he gave the germ theory, he removed the theory of spontaneous generation, he gave the understanding of the principles of fermentation, he gave the vaccines of rabies, anthrax, and cholera. So he's the father of microbiology. Robert Koch, he gave the Koch's postulates, Koch's phenomenon, bacteriological staining techniques, culture, solid culture media. So he is known as the father of bacteriology. Joseph Lister, he used carbonic acid for antiseptic surgery. So he is known as the father of antiseptic surgery. So the answer to this question, who is the father of microbiology? Louis Pasteur. Next question, which of the following organism does not fulfill Koch's postulates? So the cover test again, we write Koch's postulates, but the Koch's postulates first, let's have a look that the bacteria organism should always be associated with the lesion. Second, you should be able to isolate it in pure culture. What were the two organisms which will not be able to isolate? They are T. pallidum, Trichotima pallidum. Then you should be able to put them in the footable animal model, this pure culture, and again the same lesion should be there. So And the last one, from this animal model, again, you should be able to re-isolate it in pure form. The last later addition was the finding of a specific antibody in the serum. So what were the organisms that do not fulfill Cox's postulate? One was leprae, which we cannot grow it in the pure culture. Next was the Treponema pallidum for the pathogenic species which do not grow in the artificial culture medium. We don't have a suitable animal model for Neisseria guanori. So these were the exceptions. Let's have a look at the options. E. coli and tuberculosis. M is Mycobacterium tuberculosis. In fact, Mycobacterium tuberculosis, he satisfied the Cox postulates and said that I have discovered the agent of tuberculosis, and we celebrate planting as the word tuberculosis day. M. leprae. That is your answer.